Hi Maria, very nice seeing you again. I understand that you're here for a hair and scalp check today, is that correct?
Yes.
Okay, very good. I'll be more than happy to do that for you. So tell me a little bit about what brings you in today.
The scalp is itching.
Okay. So you have itchy scalp.
Yes.
So I can definitely take a look at that and see, what could potentially be the cause of that. But before we begin the exam, let me ask you a couple of questions. Do you have any tenderness or any pain anywhere else, anywhere in your scalp?
No.
No? Okay, very good. And what kind of shampoo do you usually use?
Regular shampoo from the store.
Okay. And do you use a conditioner with that?
Yes.
Okay, so conditioner as well. Do you use any heat-based products on your hair?
No.
No. Okay, so no hair dryer, hair straightener, or curler?
No.
No? Okay. And how do you usually prefer to keep your hair? Is it loose like this, or maybe do you tie it in a ponytail in the back or a bun?
Usually I keep it in a ponytail.
Okay, in a ponytail. Very good. That's not very good for the hair, but I do it the same way.
I see.
And how often do you dye your hair?
Every 2 months.
Every 2 months, okay. And do you use a natural dye or maybe something bought from the store with ammonia?
Natural stuff.
Natural
without
stuff.
ammonia.
Without ammonia,
Yeah.
okay. That's very good. And do you use any other products on your hair? Like any scalp serums, any styling gels, dry shampoo?
Sometimes I use a little oil to
Okay.
moisturize the hair.
So you do pay attention to moisturizing your scalp, which is very good. And have you experienced any itchiness before this started?
No.
No. So this is the first time you noticed something wrong with your scalp.
Yes.
Okay. And how about any dandruff? Did you get that as
No.
well? No dandruff. Okay, so what I'm gonna do today is I'm gonna perform a very thorough examination of your head. I'll palpate your head, I'll inspect your scalp, your hair follicles. I'll look for any lesions, any red patches or dry patches on your scalp. I'll be looking for any potential infestation, signs of fungus, folliculitis. That would be an inflammation of your hair follicle. I'll palpate your hair. I'll look for any dry patches on your scalp, and if I find any, we can definitely apply here some oil, and we'll get to the bottom of what's causing the itchiness for you.
Okay.
Sounds good?
Yes.
Good. Some hand sanitizer to begin with. Would you like some?
Yes. Thank you.
Okay. Okay, let me just put my gloves on. It's good that you came to see me before the dryness progresses any further. And I know it's very uncomfortable to have an itchy scalp.
Yes.
Okay. So let me first start by brushing your hair to make sure that everything is nice and untangled, so I can feel your head very well. Oh, you have beautiful hair.
Oh, thank you.
Very thick and luscious. Good hair distribution and a nice thick hair follicle. Okay. And on this side as well. Okay, so let me just palpate your head to begin with and make sure that there are no sore spots. Okay, let me know if you feel any tenderness or any pain while I'm touching your head.
Okay.
Okay? Do you feel any pain?
No.
Okay. I'll start with the front first. No tenderness.
No.
Okay. Okay, let me focus on the right side. No tenderness right here.
No.
Okay, very good. And behind your ear. Okay, no pain, right?
No pain.
Very good. And on your right side. Does it itch right now?
No.
Not too much. Okay.
Not too much.
And in the back. Okay. Okay, so you don't have any tender spots. I could not feel any lumps or bumps in your head area. No tenderness whatsoever or pain when I'm touching, so that's good.
Okay.
Okay, let me take my light and get a closer look at your scalp. We'll start with the front. Do you usually wear a hat during the summer?
Yes.
Okay. The front of the head is the one that's most exposed to the sun during the summer. It's good that you're wearing a hat. Okay. So the front of your head looks very healthy. I'm not seeing any signs of redness, no dryness. Hair distribution is nice and even. No signs of folliculitis. Everything looks very healthy. I'm also not seeing any dandruff. You don't have any moles. I'm not seeing any signs of infestation with any parasites, but I will take a closer look with my magnifier in a second. Okay. Definitely no redness. No dandruff. No patches of hair loss. Okay, let me just take a look with the magnifier as well. No signs of infestation. Good overall front of your hair. I'm gonna take a look at the top of your head. Okay. No redness in the top of your head either. No sign of dryness or dandruff. Do you know if you have any major moles?
I have one here.
In the back, okay.
Yes, this.
I'll pay special attention to that and I'll be careful with that area of your head. Okay. Again, a very healthy hair follicle. No signs of folliculitis. No dryness. Which part of your head usually itches more?
The back.
The back, okay. We'll get there. Okay. I am seeing a little bit of dryness over here. Do you mind if I put a little bit of oil?
Please do it.
Okay. Okay. The dryness is right about here. This is a very natural jojoba oil. I should just help the scalp heal a little bit and provide a little extra moisturizing right here. All right. I'm not seeing any signs of lice infestation in the top of your hair, but I'll take a closer look with my magnifying glass. Again, no dryness, no dandruff in the very top of your hair. I will be very gentle, don't worry. No dandruff, no signs of psoriasis, folliculitis or ringworm. Good even hair distribution. Okay, I see a little mole right here.
Yeah.
Nice and symmetric, light brown, well-defined borders. I will make a note of it though. In your left side, to keep an eye on it. Left side, about 1 millimeter, light brown, symmetric mole. Okay. Very small. Left side next. I'm going to use a hair clip right here. And the mole is right here. Okay, yeah, I see it. Okay, very well defined, red but symmetric, well defined borders, only one color, which is good. We don't like most that have several different colors. I'll make a note of it and we'll keep an eye on it. On your right side as well, top of the head in the back. It is about half, 4 to 5 millimeters, I'd say. Pretty small in size. No signs of lice infestation on this side of the head, which is good. Let me get my magnifying glass to make sure. Okay. Again, no signs of folliculitis or anything wrong with your hair follicles. Nice and even hair distribution on this side of the head as well. And clean and healthy scalp. The color of your scalp blends well with the color on your neck, which is good. Appropriate color to your ethnicity. I'm not seeing any red scaly patches, so definitely no signs of ringworm or any fungus that may affect the head area. Okay, so this side of your hair and scalp is definitely healthy. Okay, let's go around your head. So I did the front and the top, this side. Now I'm going to focus on the back. Okay, let me start by brushing the hair on the back of your head. Imagine you don't have any pain in here, right?
No. Yes.
Okay.
No pain.
I could not feel any lumps or bumps. And your head is definitely symmetrical.
area is itching a little bit.
Yes, this is the itchy area.
Yes.
I'm definitely not seeing any dandruff. Again, nice and even hair distribution in the back with a healthy hair follicle. Let me take my light and the magnifying glass and take a closer look at your scalp. Your hair follicles look healthy now. No signs of folliculitis here either. Okay. Not seeing any dandruff, no redness on your scalp. A little bit of a dry patch right here. Is it okay if I put a little bit of oil?
Yes.
Okay, right there. Okay. You can tilt your head up a little bit for me. Okay, so I applied a little bit of moisturizing oil. This should soak into the scalp and provide some hydration to this area. Let's take a look more towards the right. Yeah, no redness again. And you mentioned that you wash your hair every 2 days?
Yes.
Okay. The color of your scalp blends well with the color of your neck in the back as well. Okay, I see. You can tilt your head up a little bit. Yes, one small red mole, symmetric, one color, well-defined borders. Nothing to worry about. Okay, kind of just picking some random spots and inspecting the scalp really closely. The dryness could be, and the itching could be because during the winter time the air is more dry, so our skin overall becomes more dry as well. Okay, and then it starts itching. Okay, let me take my magnifying glass. Okay, I'm gonna check for any potential lice infestation next. You have a very clean scalp, Maria.
Thank you.
Well done taking care of your hair. Okay. I'm not seeing any dandruff in the back of your head either.
Okay.
And okay, this is where I apply the oil. It's still soaking in. No signs of any infestation with potential parasites. And definitely no signs of any fungus, ringworm, or folliculitis in the back of your head. Okay. Let me take a look at the top of your head towards the back one last time. Right there, yes. Okay, let me section your hair. This part here. Then this part over here. Perfect. Okay, the top of your head is consistent with what I have already seen. Very clean, no redness or scaliness, no dry areas or patches of hair loss. I'm not seeing any dandruff here either. No signs of fungus, folliculitis, or any skin disease whatsoever. And I'm not seeing any moles. Okay. Let me take the magnifying glass and look right here at the top of your head. I'm seeing another dry area, just a little bit, not too much. So I'll apply a little oil right here. Okay. The oil soaks in and hydrates your scalp. Even hair distribution as well, and thick, healthy hair follicle. Okay. Let me just take another random section as a final look. The back of your head looks healthy. The dryness may be due to the dry air all around us. Okay, and finally let me take a look at your right side. I'm going to section the hair and try to pull it back a little bit right here. And brush it a little bit. No redness on this side of the head either. Nothing, any dandruff. No signs of psoriasis, fungus, or inflammation of the hair follicle, which is nice and thick and healthy. Okay, Maria, so I took a very close look at your scalp. I could not see any indication of redness, any psoriasis, folliculitis, ringworm, anything wrong with your scalp. Your hair distribution is nice and normal, very even, with a healthy hair follicle. No signs of infestation, and I could spot a little bit of dry areas, but it's nothing out of the ordinary. Okay, so what I'm gonna do for you is I'm gonna give you a special oil that you can use on your scalp right after you wash your hair. Apply that a couple of times, and if you still feel the itchiness, come back and see me. Okay, sounds good?
Yes.
Okay, and for the next month or so, try not to wash your hair too often. So once every 3 to 4 days should be okay, to give the scalp an opportunity to regenerate the oils that it usually generates and be hydrated. Okay, very nice seeing you again, and
Thank you.
okay, have a good day.
Thank you.